any questions.
Yes. About how many patients are you processing each day now?
So it's variable. So realistically, so I'll give you the numbers for before this week. We were seeing about 118 total patients per week. And so we operate from 7 a.m. to 11 p.m. Monday through Friday, and 10 a.m. to 10 p.m. On the weekends. You're primarily only working the Monday through Friday. So I would say seeing anywhere from 20 to 30 patients during your shift at most. The reason I'm using the previous week's data is because over the weekend there was an exposure on the inpatient side, and that meant that we saw a ton of asymptomatic healthcare workers, and we're trying to work out a mechanism where that doesn't happen, where we absorb all those patients all at once. And so that really spiked up our numbers yesterday, over the weekend, and today as well. But theoretically, we should be seeing anywhere around 20 to 30. We depends on, if things ramp up, that might change, but right now it's been pretty manageable.
Thank you. And so how long does each of these patient encounters usually last?
So that's a good question. So it's pretty brief. Actually, the part that I need to make my medical decision making is pretty short. I'd say, anywhere from 3 to 4 minutes max. Most of the time you're trying to, you have like this script that you're running about, you have COVID most likely. If you've ever had a cold or if you've ever had the flu, for most people, COVID is going to feel like anywhere from asymptomatic to a mild cold to as bad as the flu. And the main reason why we're worried about this is because in a very tiny percentage of patients who get COVID, they get such bad COVID that they have to be admitted. And if all of those patients get sick at once, that overwhelms our capacity to take care of people. But if we spread out when they get sick, we're actually able to take care of everybody, right? And that's basically giving that spiel, some version of that spiel. So most of the time, your encounter is you talking to the patient and trying to console them a little bit. So I would say the encounter can actually last up to, as long as you want, but usually 5 minutes seems pretty reasonable. I don't know, 5 to 10 minutes max.
Okay, thanks. And then is there always going to be like an ED attending such as yourself there with us?
So we're not physically there. So again, ED is helping support the tent. We, myself, have clinical duties. So I have to physically be in the ED to intubate people and put in central lines and take care of all the critically sick patients. And so we're helping support the tent because we understand that this is a very important mission, and we're really appreciative that you guys are there helping us as well. So you will always have somebody you can talk to. They may not physically be there, but the tent is telehealth capable. All the computers have Skype video, and we also have iPads, depending on which system you prefer, to whether you like using FaceTime and checking in and checking out an iPad, or whether you like the Skype video. You will have the support. They may not physically be there, but you will always have the support of the ED.
Hi, Dr. Saladon, I have a question.
Yes.
The algorithm flowcharts, are those posted in the tent anywhere?
Yes, I will update them, but currently we have some laminated ones there. Since I'm going to change it a little bit, I will update it and put those laminated ones there. But you can always access the website, and I would highly encourage, as part of your workflow when you go into the shift, just open those two websites or the two sites, and then just have them in an open tab as your favorite, so you can always reference them.
Okay, thank you.
I have a question about break time and things, how we manage for break time or the need to go to maybe restroom or so.
Yeah, that's a really good question, and I probably should have led with that actually. So none of these patients, 0 of these patients are acutely ill, because any of the acutely ill patients are getting sent to me in the ED. Okay, so if at any point your mental health and well-being and your own kind of just your own well-being is very important to us, and so you kind of are in charge of managing your time. We're not going to micromanage that, right? So you can take whatever time you need as a break. And I'm not saying like take an hour-long break when you see the line out the door for people to be seen in the tent, right? Usually if you've seen all the patients in the tent and there's nobody else, you can kind of take a little breather. We do have RV right outside the tent, which is our break room. We do have bathrooms, portable bathrooms outside the tent as well. They're pretty nice. Like if you've been to like a festival, it's like the nice kind of porta potties, not like the shitty plastic ones. And so that is there, and it's up to you. Kind of you decide. The only thing that we ask, because the less time the patient spends in the tent, the less they are exposing other patients as well as our staff. We ask that if there's patients to be seen, clear out the tent before you kind of take a break. But yeah, most of the time there is downtime, and so it's kind of a classic ED urgent care flow, which is feast or famine. It's not scheduled appointments, so it's either busy or not busy at all. There's very little in between.
So if you do need to take a break, then do you have to go through any sort of elaborate doffing process? Because I hear that one of the most riskiest times to get exposed is during the doffing process.
Really good question. And so the answer is yes, you do have to go through a doffing process. Whether it's elaborate, I guess it's up for interpretation. So what I do is I doff everything but my surgical mask. And I save my face shield because those are in shortage right now and we can reuse those, but everything else I take off: the gown, the gloves, right? And so it's not, it's pretty straightforward. And the reason, and you're right, it is a risky time, but you have to understand the context, right? So you're not there intubating somebody where you created this aerosolization. You're not there with somebody who's like hacking a lung without a mask. You're in the space of the tent that has UV light and HEPA filters, where the patient is masked, you're fully gowned, and you're at a distance. You're at not just the safe distance, the 3 feet, you're beyond that distance. And you're not even close to touching the patient, right? You're not putting in an IV, you're not like putting a blood pressure cuff, you're not there like doing a physical exam. So yes, you do doff. Whether it's risky for you at this point, given the way that we're seeing patients in the tent, I would say it's pretty low risk. I still want you to practice good doffing technique, and I can send you videos. I can put those videos up on the WikiM. And UCLA, I think, has some doffing videos where it's basically, you're removing the gown externally and you're just kind of rolling it up and then removing it together with your gloves into the trash bin. But you're right. No, you do want to doff everything because you don't want to cross-contaminate your break room or your bathrooms.
Thank you.
Yep. Any other questions?
I have one more just follow-up question to that. So is it the same surgical mask that you're wearing throughout the day? You're not changing between patients, like you're even between like doffing everything else, you're going to maintain that same surgical mask?
So I'm not going to micromanage that. I think we have to strike a balance of conservation and preserving what our PPE supply, but also kind of using your judgment as to whether or not you think that mask is soiled, right? So if you feel that you need to change it after every encounter, I think that's probably a little too much, especially given the context that I mentioned, right? And you also have the face shield in front of you protecting that. Right. And that being said, if you think you just saw a patient that is like, wow, there's 100% certainty that this patient has COVID, and you are just, for your own mental well-being, you want to switch out the mask, I'm not going to stop you there. Like if you want to do that every once in a while. For me, since I've been working there since the 18th of March, periodically, I typically do one mask. Maybe I'll switch it out in the middle of the day because it's a level 1 mask. So it kind of, gets destroyed after me talking all day. So I switch it out, and I'm fine with you guys switching it out periodically, especially if you think you just saw somebody who's high risk. I'm not, we're not going to fight you over that. I think that's a very reasonable thing. But if you're switching it out after every patient, especially if you're following all the rules of seeing patients in the tent, I would say that's probably a little too much.
Okay, thank you.
Any other questions? And I'm not going anywhere. I mean, my cell phone is listed on the whiteboard there, so I'm available, as well as the rest of the leadership team, Kian, Elizabeth, and soon to be, we're adding another ED provider to help support this. Again, we're doing this on top of our clinical duties. So like today was my day off, and so Kian and Elizabeth have come in before their clinical duties. So we're there to support you. We want you to feel supported. And this is a kind of an all hands on deck type of scenario that doesn't happen very often. And we're very appreciative that you're there. And, all of you get to wear a badge of honor that you're helping out, in this time of need, and you stepped up, and it's pretty amazing actually. We're glad to have you. And again, we're making sure that you always feel protected and always feel supported. And if at any point, you have any feedback for us, or if you're feeling like, hey, something doesn't feel right, you can reach out to me and give me a text, or send me a text, or give me a call. We can kind of help resolve any issues that you have or concerns. Cool.
Great, thank you.
Thank
All righty.
Thank you.
All right, take it easy. I'll see you guys there.
Thanks so much.
Thanks.
Thank you.